Welcome back to Learn with Professor Janula. I'm so glad you're here today. In this session, we'll be exploring an important topic: minor discomforts during pregnancy. Pregnancy is a beautiful journey, but it often comes with some common challenges. From morning sickness to back pain, and from fatigue to heartburn, these discomforts are experienced by many mothers-to-be. The common discomforts during first trimester of pregnancy are breast tenderness, pulmonary erythema, constipation, nausea, vomiting and pyrosis, abdominal discomfort, fatigue, muscle cramps, hypotension, varicosities, heart palpitations, frequent urination, leukorrhea. Here we will discuss about its management also. One of the very first signs many women notice in early pregnancy is breast tenderness. This happens because of hormonal stimulation, mainly estrogen and progesterone, which increase blood flow and prepare the breasts for milk production. As a result, the breasts may feel heavy, swollen, or even slightly painful. To ease this discomfort, it's important to wear a well-fitting, supportive bra. Choosing one with wide straps can help distribute the weight evenly and reduce strain on the shoulders. Remember, these changes are completely normal, and a little comfort support goes a long way in making pregnancy easier. Another minor discomfort that can appear during pregnancy is pulmonary erythema. This is when the palms of the hands become constantly red and may feel itchy. The main reason is the rise in estrogen levels during pregnancy, which increases blood flow to the skin. To manage this, it's best to avoid harsh detergents or soaps that can make the irritation worse. Applying a gentle soothing agent, like calamine lotion, can also provide relief. Pulmonary erythema is usually harmless and disappears after delivery, but simple care measures can make it more comfortable during pregnancy. Constipation is another common discomfort experienced during pregnancy. It happens because the hormone progesterone relaxes the intestinal muscles, which slows down bowel movements. To ease constipation, pregnant women are advised to include plenty of fiber-rich foods in their diet, such as fruits, vegetables, and whole grains. It's equally important to increase fluid intake. Aim for at least 8 glasses of water a day. A simple home tip is to drink a cup of warm milk before bedtime, which may help stimulate bowel movements. With these small lifestyle changes, constipation during pregnancy can be managed safely and effectively. One of the most well-known discomforts of early pregnancy is nausea and vomiting, often called morning sickness. It usually happens because of hormonal changes and increased sensitivity of the stomach. To manage it, try to avoid having an empty stomach. Eat several small meals throughout the day instead of large ones. Drink fluids between meals rather than with meals, as this helps reduce the feeling of fullness and nausea. And one more tip: avoid fried or oily foods, as they are harder to digest and can make nausea worse. With these simple adjustments, morning sickness can be made much more manageable. Another very common discomfort during pregnancy is fatigue. Feeling unusually tired is normal, but fatigue can also make other symptoms, like morning sickness, worse. To manage it, try to get a full night's sleep without interruptions. Prioritizing rest is essential for both mother and baby. Eating a healthy, balanced diet helps maintain energy levels throughout the day. If possible, schedule a short nap in the early afternoon, and most importantly, listen to your body. When you're feeling tired, take a break and rest. Remember, pregnancy is hard work for your body, so self-care and rest are key. Many pregnant women experience muscle cramps especially in the legs. These painful spasms often occur at night and can be linked to changes in circulation, posture, or mineral balance. If cramps are frequent, a woman may be advised to take magnesium citrate, but always under medical guidance. Simple measures can help too. Elevate the legs frequently, and when a cramp strikes, straighten both legs and flex the feet toward the body to relieve the pain. In some cases, your healthcare provider may also recommend additional calcium supplements, which can reduce leg spasms. With these steps, muscle cramps can be managed and made less distressing during pregnancy. Another condition that can occur during pregnancy is supine hypotension. This happens when a woman lies flat on her back. The growing uterus presses on the vena cava, the large vein that carries blood back to the heart. As a result, blood return is reduced, leading to dizziness, lightheadedness, or even fainting. To prevent this, pregnant women are advised to rest or sleep on their side, preferably the left side, rather than on their back. This simple position change helps maintain healthy blood flow and keeps both mother and baby safe. Varicosities, or varicose veins, are another common discomfort during pregnancy. As the uterus grows, it puts extra pressure on the veins returning blood from the lower extremities. This can cause the veins to become swollen, inflamed, and sometimes painful. To manage varicosities, simple lifestyle measures can help. Walk daily to improve circulation. When resting, elevate both legs above heart level to reduce pressure. And avoid standing in one position for long periods of time, as this can worsen the problem. These habits not only ease discomfort, but also promote healthier blood flow during pregnancy. Some pregnant women notice heart palpitations, a feeling that the heart is pounding or beating faster than usual. This usually happens because of circulatory adjustments. During pregnancy, the body increases its blood supply to support both mother and baby, and the heart works harder to keep up. While occasional palpitations are common, it's important to be cautious. Any persistent or troubling palpitations should always be reported to a physician or nurse midwife for proper evaluation. Most of the time, they are harmless, but checking with a healthcare provider ensures both mother and baby stay safe. Frequent urination is another common discomfort in pregnancy. It happens because the growing uterus presses on the bladder, especially in the first trimester, making women feel the urge to urinate more often. This sensation usually eases after about 3 months, but may return later in pregnancy. To manage this, empty your bladder as soon as you feel the urge. Avoid caffeinated drinks, since they can increase urine production. And try to reduce fluid intake after dinner, which can help minimize nighttime trips to the bathroom. Frequent urination is usually harmless, but these simple habits can make it less bothersome. Some women experience abdominal discomfort during pregnancy. When standing up quickly, it's common to feel a pulling sensation or even a sharp, sudden pain in the right or left lower abdomen. This usually happens because the round ligaments, which support the uterus, are being stretched as the baby grows. While the pain can feel frightening, it's generally harmless and short-lived. Taking your time when moving, especially when getting up from a sitting or lying position, can help reduce this discomfort. Another common change in pregnancy is leukorrhea. This refers to a whitish, sticky vaginal discharge, or sometimes just an increase in the normal vaginal secretions. It happens because of hormonal changes and increased blood flow to the reproductive organs. Leukorrhea is usually harmless, but it can feel uncomfortable. To manage it, A woman may use a perineal pad to stay dry and comfortable throughout the day. If the discharge becomes foul-smelling, greenish, or causes itching, it's important to consult a healthcare provider as it may signal an infection. In most cases, though, leukorrhea is just another normal part of pregnancy. Now let's look at some of the common discomforts during the middle to late stages of pregnancy. Backache. As the abdomen grows, posture changes and added weight puts strain on the lower back. Proper body mechanics, supportive footwear, and gentle exercises can help ease the pain. Headaches are another common discomfort during pregnancy. They often occur because of the expanding blood volume, which puts extra pressure on the cerebral arteries. This can cause mild, occasional headaches that are usually harmless. But here's an important point. If a woman experiences a continuous sharp headache, it may be a warning sign of high blood pressure during pregnancy, also known as preeclampsia. So while mild headaches can be managed with rest, hydration, and relaxation, any persistent or severe headache should always be reported to a healthcare provider right away. Many women experience dyspnea or shortness of breath during pregnancy. This happens because the expanding uterus pushes upward against the diaphragm, which compresses the lungs and makes breathing feel more difficult. To relieve this discomfort, it helps to sleep with the head and chest elevated, using extra pillows. Sitting upright and practicing slow, deep breathing can also provide comfort. Although shortness of breath is usually normal, if it becomes severe or is accompanied by chest pain, it should always be reported to a healthcare provider. Most women notice ankle edema or swelling of the ankles and feet, especially in the later months of pregnancy. This happens because of increased fluid retention and the pressure of the growing uterus on blood vessels in the pelvis and legs. The best way to relieve edema is by resting in a left side lying position. This improves circulation, helps the body return fluid to the heart, and reduces swelling. Ankle edema is usually normal, but if the swelling is sudden, severe, or involves the hands and face, it may be a warning sign of high blood pressure and should be reported to a healthcare provider. Starting as early as the 8th to 12th week of pregnancy, some women begin to feel Braxton Hicks contractions. These are periodic tightenings where the uterus contracts and then relaxes. They may feel uncomfortable, but remember, Braxton Hicks contractions are completely normal and are sometimes called practice contractions. If they become bothersome, try changing your position or doing some mild exercise like walking, which can often reduce the sensation. Unlike true labor contractions, Braxton Hicks are irregular, painless, and usually subside with rest and hydration. These discomforts are typically caused by physiological changes and hormonal fluctuations. Effective management often involves lifestyle adjustments, self-care, and simple home remedies with professional guidance, enhanced well-being of the mother. That brings us to the end of today's session on minor discomforts of pregnancy. I hope you found this video informative and helpful. Thank you so much for watching. And don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.